You've likely seen or been told by someone in the service industry, whether it's the clerk at the grocery store or the wait staff at your favorite restaurant, sorry for the wait, we're sort of short-staffed at the moment. Well, it's been a topic we've been covering extensively over the last 2 years, and it seems no industry out there in Idaho is immune, and that includes hospitals and healthcare systems. According to the Idaho Business for Education, roughly 9,000 healthcare jobs in Idaho are unfilled. Idaho Business for Education CEO Rod Grammer went as far as to call this deficiency a crisis, and a crisis that needs a solution. Well, healthcare experts across our state discussed some of those solutions today at Boise State. How to retain current staff, how to recruit new staff, and create interest in the industry in general. Here's Andrew Bartline.
It's a big question for young adults to answer.
Have you thought about what you want to do as a career?
I kind of wanted to go into real estate.
Do something with filming and photography.
Hardware set of computers, just something with computers.
And the workforce needs them. A recent report from the Idaho Department of Labor says 2.7 jobs are posted for every one unemployed Idahoan.
You can't drive around anymore without seeing business closures, staffing shortages, and healthcare certainly not immune to that.
St. Luke's president and CEO Chris Roth says the healthcare industry has been short-staffed for years. At any given moment, his hospital system has 5 to 8% of jobs unfilled. But at peak COVID levels, St. Luke's saw 12% of their jobs unfilled. That's more than 2,000 vacant jobs in total.
There's absolutely no evidence that vaccine mandates or requirements had any impact on the workforce challenges and shortages. I think there's a greater body of evidence of the fact that healthcare workers, particularly frontline healthcare workers, went through an incredibly traumatic period.
As you can imagine, there's a domino effect that the more we're short, then the people that are working harder, and then it gets harder to recruit because people see it as a very difficult field.
Healthcare leaders from across the Gem State filled up the Boise State Alumni Ballroom to discuss solutions. St. Alphonsus Executive Medical Director Dr. Patrice Burgess says the industry needs to create interest among young adults to choose a career in healthcare.
That every single day, you know, no matter what role you play in healthcare, that you've made a difference in someone's life.
But some kids just aren't into it.
I've thought about that a lot. I really like the idea of helping people. It seems like it'd be very overwhelming for me. I don't think I could handle the stress and the kind of horror of it.
My mom's a nurse, so a little bit, but it's not really my thing.
It's a delicate line to walk. The choice between supporting the stressed staff already in place and sending resources to pull in new talent.
There are indications that the interest of pursuing a profession in healthcare is waning a little bit.
Healthcare leaders don't think these problems will last forever. Experts on the panel say the industry needs to reevaluate how they recruit workers. The panel says it's important to consider candidates from all walks of life and ability and not just seek out the perfect student academically.
Healthcare is open to everyone, and as a matter of fact, we need more healthcare workers that look like the population.
It's a strategy leaders in the Idaho healthcare industry are willing to try, all in an effort to find the right candidate.
Hopefully graduating with my EMT certification.
To find people like Avery Ellsworth, who might blend in among a crowd of her peers, but is more than willing and capable to stand out and answer the call.
Helping people in general is kind of fun, and then I took an EMR course earlier this year, and that was really fun too, so I was like, I want to do it.
This isn't just a shortage of doctors and nurses. This is for IT workers, HR departments, top to bottom. Hospitals have a wide range of jobs they need to fill, and they're desperate to collaborate and get those jobs filled, which we heard today was actually a slight positive from the pandemic, Brian. Hospitals, now more than ever, at least in these panelists' careers, say are in close communication with each other, something that really wasn't needed before, but is certainly in place now.
And it's certainly going to be an industry to keep an eye on over the next couple of years, especially with some of these rules and, of course, the pushback we've seen during the pandemic, but the new rules and laws that are being put in place to kind of monitor what medical health providers are able to provide. It'll be interesting to see who wants to get into that career.
There's a lot of nuance there for sure.
All right. Thank you very much, Andrew.